I want to tell you about my journey of the last 9 months with learning about my tongue tie. The journey starts more about 10 years ago when I had this fleeting thought of, I don't breathe right. Now, how do you walk into a doctor's office and say that? Obviously, I am living, I am breathing, I'm fine. That's the baseline. But there are people today doing really interesting research, and that has been something that I've learned about in this journey. So, about 9 or so months ago, I started to believe that I had a tongue tie. This was when I was also thinking about my diagnosis with Elhers-Danlos Syndrome and that path. There's a couple different types of tongue ties, and the type that I had has really only been founded since 2004. So that is a posterior tongue tie. A lot of times, typical tongue ties, anterior tongue ties, are found in babies and typical with breastfeeding problems. So that exactly wasn't my case in the late 70s. So as I mentioned, the early aughts was when this posterior tongue tie started to become more well-known and researched. At that time, just about was when I had my second pair of braces. So I've always had a continual shift in my mouth with my teeth, and have sought orthodontia to align my teeth. At that time, that orthodontist knew that there was an underlying problem, but we didn't know enough information about the true root of that underlying problem. So at that time, about 20 odd years ago, I was diagnosed with a tongue thrust. I had physical therapy. I had speech therapy to help me move my mouth a little bit better and correct my swallow. And there's always been some difficulty there with improper swallow. So with this journey of investigation for me, I started learning about this tongue tie issue. And some hallmarks of a tongue tie are a lot of tension here in the neck, in the chest, in the shoulders, back of the head. And that's what was starting to get looked at back when I was having that physical therapy back in 2004. So physical therapy was also part of that regimen with my second round of braces. They were targeting my cheek muscles, doing shock therapy, rest and massage for my head, but it would always become tense again. So no matter how much manipulation was happening, it would still continue to be locked down. About 2002 timeframe, I was also getting myofascial release massage from an occupational therapist, and she definitely noticed that I had a forward head posture. So my head was being pulled to the front, my shoulders were being pulled back, and she also tried through massage and myofascial work to release and relax these muscles. And that also filtered down into the hips. I have very tight hips. My SI joint is tight, and I do have incontinence. So these hallmarks really started pointing towards a potential issue. Now, I could be incontinent for whatever reason, but not typical for a single woman without children in the mid-40s. And this has been going on for about 15 years. So I feel empowered by Coach Prime and his information, but I think this is really important for people to understand that if you think there's something wrong with your body, there might be an underlying reason. We might not know what it is, considering we're still finding things out now about our bodies. But anyway, so I was on a couple groups with Elhers-Danlos Syndrome, and a couple people were bringing up tongue ties. So I went to pursue a diagnosis, and I did get a diagnosis. I went to see a myofunctional therapist who helps work with the muscles of the mouth to help with surgery, as well as a dentist who does tongue tie releases. So both of those providers were telling me that I do have a tongue tie. Interestingly enough, these providers, specifically my myofunctional therapist, is trained in airway development and airway function, and we talked a lot about that. And that little piece that came up about 10 years ago on that hike, that I don't breathe correctly, was finally validated. I breathe up in my chest, and I have learned how to breathe with my diaphragm. I have a poor exchange of oxygen and carbon dioxide, and so that also adds to different issues. And the tongue tie has attributed to some sleep apnea, and I have been waking up in the middle of the night around 2 a.m. for about the last 15 or so years, give or take. If that's part of the tongue tie, we'll find out, because I am going to have a release in about 2 weeks. So speaking with this myofunctional therapist, she did talk to me about how the mouth should work, how the tongue should work in the mouth, and I have been overcompensating with all of the wrong muscles, where it's the tongue that should be doing the work, but it is locked down. So it's the fascia and the muscles and tissue that are holding the tongue down. So the tongue should sit in the roof of the mouth. And this is something that the speech therapist told me, and I didn't have any visuals, and I'm a visual learner. She said the tongue should rest at the top of the mouth. Well, I thought mine did. Lo and behold, it's the back of the tongue that is not able to reach up for me, and that's where we get that posterior tongue tie. So it's not the tip of the tongue that's being locked down, it's the back. So there is not a fully formed proper airway, and the tongue is locked down, so it can't function properly. So with that tongue tie release, the tongue should go to the top of the mouth. And that's what the myofunctional therapy is helping with, to learn how to properly use my tongue once that release is done. So they do go in typically with a laser to cut a few layers so that the tongue becomes untethered from the bottom of the floor of the mouth and can release and go to the top. So in normal development with babies, the tongue does help the structure of the mouth. It helps with creating a good arch shape of the teeth. And when that tongue is locked down, it can create some high narrow palates, and that can affect breathing, airways, sleep, and they have done some really interesting studies about children and sleep, how lack of sleep could look like ADHD or present in other ways. So it really rolls up to so many different issues. And so I'm finding that a lot of these issues that I previously described all roll up to that tongue tie. And I'm hopeful that once that gets released, that the tension in my neck, shoulders, back of my head, potentially sinus, potentially breathing, opens up. And there are people that say that they feel a tongue tie release down in their hips. They say that it does affect incontinence and alleviate some of those issues. And I am going to see a dentist who is trained in specifically doing tongue tie releases, and is trained in airway issues, to have my tongue tie released in 2 weeks. So I highly encourage you to keep scratching at the surface, if there's something about your body that you don't think is correct, keep asking questions. As I said, a lot of this research is brand new within the last 20-25 years. There's a Dr. Zaghi, who is doing a lot of airway research with the tongue and the fascia, and it's very interesting. We should normalize talking about these issues, and I am here to provide information and in hopes that you find answers. So I'll be back in about 2 weeks after the tongue tie release. I am not going to show you my tongue. I'm not going to do that. You can find lots of pictures and lots of rabbit holes on the surgery, on the issues, potentially how to diagnose yourself, but a real diagnosis can come from the professionals. So here's hoping that I have relief with my release and sleep through the night, have a better posture and openness, and that rolls down through the rest of my body.